Hi, I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and information and commentary on all sorts of exercise and sports injuries for athletes and active people so that you can stay healthy and perform your best. One of the most common questions I get, patients but friends and family alike, is, I got this popping in my knee, is it a big deal? I mean, I can't tell you how many people ask me that on a regular basis. It may hurt, it may not hurt. But in today's Ask Dr. Geier video, I want to address that very question, but with a specific type of person, specific type of athlete. Okay, Abigail in Chicago asks, "Hi, I'm a junior in high school. I'm extremely active and play tennis almost every day. I've been experiencing no pain in my knee. However, my knee cracks almost every time I lean down. Should I be concerned?" Well, like I said, it's a terrific question. And the key point about that is, should I be concerned? I think that is the question to ask. But first, let's talk about potentially what it is. Now, there's a lot of reasons you can have popping in the knee. And usually, especially in your younger people, that popping is coming from underneath the kneecap or the patella. And it's really common. Now, as you get into your 40s and 50s and 60s, you can have normal reasons for popping. But at that point, you can also start to have breakdown of the cartilage lining under the kneecap. And that can cause a roughened surface. And that can cause popping or cracking or grinding. That sensation, by the way, is what we call crepitus. But you can also have popping and cracking under the kneecap in high school and college age. I like to say that if you go find a high school girls soccer team or basketball team and feel their kneecaps and then bend their knees back and forth, probably a third of the players on that team, a third of the female athletes, and I'm just making that number up, I've never tried this, but I'm guessing that it would be about a third, would have a popping or grinding underneath the kneecap. And they'll have no pain at all, much like what Abigail's talking about. And that can be related to a number of things. They probably at that age don't have cartilage damage under their kneecap. You can have softening of the kneecap, what we used to call chondromalacia. That's part of an overall spectrum now that we call patellofemoral pain. But you can have, abnormal tracking of the kneecap. Again, not anything worrisome, but just related to the anatomy of young female athletes' knees and lower extremities. You can have just the way the kneecap runs. You can have popping related to the movement of the joint fluid in the knee. There's all sorts of reasons that aren't necessarily worrisome. Certainly nothing that needs any kind of surgery. I would argue it doesn't need any kind of x-rays or MRIs, especially if it's not causing pain. Now, if you have popping, but you do have pain related to that, or pain in the front of your knee with or without the popping, that's a little different story. That can be a very common problem as well, and I've talked about it in an Ask Dr. Geier video as well, called patellofemoral pain. Very, very common in young active athletes. I had that when I was young. I actually have and still have, or had back then and still have, popping under my kneecaps as well. But that's something that, the patellofemoral pain, that we can get better with some home exercises, sometimes physical therapy. So having said that, not that I would say all popping is potentially benign, but in young active people, from 10, 12 years old, all the way up into the young 20s, maybe 30s, that have popping and no real pain with it, I don't think it's usually anything worrisome, usually not necessarily something that you have to work up. But if you're concerned about it, it's getting worse, or it's getting painful, I think there's no harm in going to see a sports medicine doctor or an orthopedic surgeon. Not that you need surgery, but just to check out, see what potentially it is for you, and see if it's something that you can continue to play and train through. Now, do you have popping in your knee? Do you worry that it's a big deal? I'd love to hear your experiences. So below this video, share your experiences, what kind of symptoms you have, when it bothers you, and what you decided to do about it. I'd love to read it, but I think other people would like to learn from your experience as well. And if you know somebody that has popping in their knees, potentially worried about it, or maybe it's a parent that has kids with that type of problem, I'd really appreciate it if you'd share this video with them, so hopefully that this information can help them kind of make a decision on what they should do about it, if anything. Now, if you like videos like this and you want more information on injuries and injury treatments and injury prevention in all types of sports and exercise, I record a number of these videos every single week. So subscribe to my YouTube channel. I'd love to deliver these videos directly to you. and last. There's a ton of resources that I create, video, audio, written resources that I only share with my email list, completely free. So go to my website, drdavidgeier.com, and enter your name and your email list, and I'll deliver those resources on ways to stay healthy and perform your best. I'll deliver those directly to you. Thank you so much for watching. I hope this was helpful. If you have popping in your knee, maybe this video was helpful, and I'd love to hear your thoughts below this video. But if you have questions and you'd like to submit those for a future Ask Dr. Geier video, definitely do that as well. And I look forward to seeing you right here next time.